how can health system pharmacists help with the obstacle of keeping patients adherent on those multiple medications?
One of the things that we, in my opinion, have gotten too caught up in are guidelines. Guidelines are helpful in terms of having an objective group of people look at a body of evidence and say these are good things and these are marginal things. But what we don't have are guidelines for somebody that has multiples. Our patients have diabetes, hypertension, congestive heart failure, hyperlipidemia, and they smoke. That is a everyday scenario. There are no guidelines for that. We have to know our patients and understand what are the things we can realistically try to make better today and tomorrow and 2 months from now and 2 years from now. Obviously, the biggest impact we can have is smoking cessation for many of the heart conditions that we're talking about. But it's a very hard journey. It's one that takes, the average number of times somebody tries to quit smoking before they're ultimately successful is 7. And so to get them to step up for that next time is something that their healthcare team needs to be a part of. And it may not be a health system pharmacist. It may be a health coach that is the person that is leading the charge on that situation. Or it may be their primary care physician that's saying, okay, let's get together and develop a strategy for Ms. Jones. She's had this change. We know about that she had a fall last week, and so is she still a candidate for NOAC therapy for her AFib? And the physical therapist or occupational therapist that goes into the home and helps with assist rails out of the tub. That may be the most important thing that can happen in that situation. But as the cost and the co-pays and the co-insurance become such critical factors, we see PBMs become a huge part of the conversation, and that's something we don't have any control of and feel quite powerless in those conversations that influence many of the things that we're left with in terms of therapeutic strategies. So to integrate all of that into that strategy, what we're seeing is chronic care team meetings that involve the primary care doctor, sometimes the specialist, the pharmacist, the health coach, social work, as well as the clinic nurse, who we see as a critical part of the glue that holds it all together for knowing what the last phone call was with this patient. And that if we can get them just to do something so simple as run out of their medicine at the same time so that refills happen at the same time, we've accomplished big things. Now, that's not very glamorous or sexy, but it's very practical and it's very meaningful in terms of trying to produce the sorts of things we're talking about.